Thank you. Very good evening to all. Post-exam this session. So we'll see what were the physiology questions and biochemistry questions that were asked in your exams. So let's start with some of the basic questions that were asked. Over to the first question in physiology. So the question was actually a very easy question, but in differently asked pattern, sequential arrangement question. So this is what INICET exams focus on. So asking you the same basic concepts, but in a different pattern of the question. So this is a different pattern question, sequential arrangement question. So you have to arrange in sequence the following structures in the auditory pathway. So let's do that. So the answer is actually option A, B, C, D, E, F, and A. So if you want to answer this question, you should be thorough in the auditory pathway. What is auditory pathway? The mechanism of how we hear sounds. That is called auditory pathway. Let's quickly learn about auditory pathway, and then we'll come back to this question. So over to the auditory pathway, the mechanism of how we hear. This looks actually very like a complicated topic, but it's not actually a complicated topic. Very, very simple topic. Little bit of concepts if you understand. Very easy topic. So in the very easy way, I'm going to teach you the auditory pathway. Let's do that. When sounds enter your ear, any sound that you hear, when it enters into the ear, the sounds pass through the external auditory canal. Then it touches your tympanic membrane, the eardrum. The tympanic membrane is going to vibrate now because of these sounds. Tympanic membrane is in contact with the ear ossicles, malleus, incus, and stapes, the ear bones. So this is going to vibrate your ear bones. That is in contact with the inner ear. So this transmits the sound vibrations into the inner ear. What is the inner ear made up of? Inner ear is made up of cochlea, the round and round spiral structure, snail-like structure that you see, that is called as the cochlea. And the inner ear also has semicircular canals in it. So I'll shade that in green now. Semicircular canals, atricle and saccule. What are they called as? Semicircular canals, atricle and saccule. Together, you call them as vestibular apparatus. Vestibular apparatus. What is the role of vestibular apparatus? See, whenever there is any change in your head rotation, any head rotation or accelerations, horizontal acceleration, vertical acceleration. See, example for all this head rotation and accelerations. One common example, when you go on a roller coaster ride, see how it happens. The roller coaster, it moves up, it moves down, it turns your head, it twists you all around. So your semicircular canals, atricle and saccule, they sense all these changes. Semicircular canals, they respond to head rotation, changes in head rotation. Atricle, this responds to horizontal acceleration. Horizontal acceleration. What is horizontal acceleration? For example, when you go very fast on a car like that, just it crosses the highway at a very high speed, that is a horizontal acceleration. Saccule responds to vertical acceleration. Vertical acceleration. What is the example for vertical acceleration? In a lift, so very fast when you go on a lift like that from ground floor to the first floor, quickly when the lift ascends up, that is a change in vertical acceleration. So all these head rotations, horizontal acceleration, vertical acceleration, all this is sensed by your vestibular apparatus. And therefore, they correct all these changes and they give you a balance. So what is the role of vestibular apparatus? To give you balance and equilibrium. So vestibular apparatus plays main role in giving you balance and equilibrium. Then what about the other organ, cochlea? What is the role of cochlea? The snail-like round and round structure, that is the cochlea. What is the role of cochlea? Hearing mechanism. The auditory pathway, what we learn in auditory pathway, it's all about the cochlea. Cochlea helps in hearing mechanism. Now let's discuss in detail the mechanism of hearing. We'll zoom into this cochlea. The snail-like structure that you see is the cochlea. So now I'm going to zoom into the structure of the cochlea. Look at the structure of the cochlea. The cochlea has two membranes. On top, rhinous membrane. On top, rhinous membrane. And below you have basilar membrane. There are two membranes, rhinous membrane and basilar membrane. The rhinous membrane is on top.
वो तो on the spot link आता है.
The rhinous membrane is on top, and rhinous membrane and the basilar membrane together, they divide the cochlea into three layers: scala vestibuli, scala media, and scala tympani. Scala vestibuli and scala tympani both are rich in sodium ions. The fluid in scala vestibuli and scala tympani is called perilymph. Perilymph. Since perilymph is rich in sodium, can you tell me which fluid is rich in sodium? The extracellular fluid or intracellular fluid? Yes, the extracellular fluid is rich in sodium. Therefore, perilymph is comparable to that of ECF because extracellular fluid is rich in sodium. This also is rich in sodium. So perilymph fluid is comparable to that of ECF. What about scala media? Scala media is rich in potassium ions, and the fluid in the scala media is called endolymph. Endolymph. Intracellular fluid, ICF fluid, is rich in potassium. So you can compare endolymph with that of ICF. So this is like intracellular fluid. The basilar membrane, look at the structure of the basilar membrane. This is the basilar membrane. On the basilar membrane, you have a special organ called organ of Corti. Organ of Corti. So I'll just shade organ of Corti in blue now. Look at the organ of Corti. So this is the organ of Corti. Very important organ for hearing mechanism. Now let's zoom into this organ of Corti. So I'm going to zoom into the organ of Corti. This is the structure of organ of Corti. Organ of Corti has a basilar membrane, hair cells, supporting cells, dater cells, pillar cells. The hair cells are very, very important because the hair cells only the receptors for hearing mechanism. The hair cells are the main important receptors for hearing mechanism. And the hair cells on top, they are in connection with the tectorial membrane. This is the organization of organ of Corti, the structure of organ of Corti. The structure is important because when sounds enter into the ear, the sound is going to vibrate your basilar membrane. When this basilar membrane vibrates, it will push on these hair cells. The basilar membrane vibrates to push on the hair cells. So the hair cells are going to move now. So these are the hair cells. The hair cells are going to move. Let's see that. So this hair cells, you can see, this is the structure of the hair cells. There are different heights of hair cells. The shorter one, look at this, the shorter hair cells and the taller hair cells. The shorter hair cells are called stereocilium and the tall ones are called kinocilium. When the basilar membrane vibrates, it pushes on the hair cells. When it pushes on the hair cells, stereocilium is pushed towards the kinocilium. The shortest ones are pushed towards the taller ones. Stereocilium is pushed towards the kinocilium. And they are all connected by tipplings. So this is going to move the tipplings. When the tipplings move like this, this opens up cation channels. Cation channels open and cations enter inside. Which cation would you think will enter inside? Sodium or potassium? Exactly, potassium. Why potassium? Because we already saw that scalar media is rich in potassium. Since scalar media is rich in potassium, potassium from the scalar media would easily enter into this organ of God type. So into the hair cells, potassium enters inside. Potassium is a positive ion, K plus. K plus is a positive ion. Whenever a positive ion enters into the cell, it will cause depolarization. Depolarizations. And depolarizations result in action potentials. Action potentials. And these action potentials are carried by the 8th cranial nerve. Which is the 8th cranial nerve? Vestibulocochlear nerve. And the 8th cranial nerve takes it into the auditory cortex. And when it touches your auditory cortex, you're able to hear the sounds. See, one important point here, the depolarizations caused. Elsewhere in the body, sodium influx only causes depolarization. Sodium entering into the cell will cause depolarization. But this is only exception in the body where potassium entering inside is causing depolarization. Everywhere else in the body, sodium entering inside would cause depolarization. Or even calcium entry will cause depolarization. In SA node and smooth muscles, calcium entry also causes depolarization. But nowhere you will see potassium entry causing depolarization. This is only one exception where potassium entering inside, K plus entry is causing depolarization, and that sets up action potentials. And this action potential is carried by the 8th cranial nerve, vestibulocochlear nerve, into your auditory cortex. Where is the auditory cortex? Temporal lobe, near the ears. When it touches your auditory cortex, you're able to hear the sounds. This is the mechanism of hearing. What is the auditory pathway here? From the 8th cranial nerve, how they reach the auditory cortex. That is called the auditory pathway. What is this pathway? The easiest mnemonic for this pathway, E, Ho, Li, Ma. E for 8th cranial nerve, C for cochlear nucleus, O for olivary nucleus, L for lateral lemniscus, I for inferior colliculus, M for medial geniculate body, and A for auditory cortex, ecolema. From the 8th cranial nerve, it passes through all these structures in sequence to reach the auditory cortex. Once it touches auditory cortex, you are able to hear the sounds. That is what your question on. Arrange the following structures in sequence. So the question is actually on ecolema pathway only. Let's go back to this question. So I'll write that E-co-le-ma. E for 8th cranial nerve, C for cochlear nucleus, O for olivary nucleus, L for lateral lemniscus, I for inferior colliculus, M for medial geniculate body, and A for auditory cortex. Now, can you arrange this in sequence? So we will start with cochlear nucleus, olivary nucleus, lateral lemniscus, inferior colliculus, medial geniculate nucleus, and auditory cortex. So the answer is option A. Very simple. Once you know the auditory pathway and the mechanism of hearing, this becomes very easy. See, there is one mostly accepted theory related to the hearing mechanism, that is called traveling wave theory or von Becquerel's theory or the place theory. What is this about? When sounds enter into the ear, the basilar membrane analyzes the sounds into low frequency sounds and high frequency sounds. Low frequency sound and high frequency sounds. What is a low frequency sound? When you hear an auto horn like this, boom, if you hear a sound like that, just one sound, that's a low frequency sound. This low frequency sound would reach the apex of the cochlea. Cochlea is round and round. It has a base and it has a tip. The tip is the apex. Low frequency sounds, they reach the apex of the cochlea. So there is a place for low frequency sound, which is that place, apex of the cochlea. High frequency sounds, they reach the base of the cochlea. What is a high frequency sound? Have you heard this horn sounds of lorries and buses on the highway? Pom, 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 pom. When you hear a sound like that, continuous sound, that is a high frequency sound. When there is a high frequency sound, that reaches the base of the cochlea. Low frequency sound, apex. High frequency sound, base. So the waves are traveling as low frequency waves and high frequency waves. That's why it is called traveling wave theory. Or there is a different place for low frequency, apex. There's a different place for high frequency, the base. That's why it is called the place theory, proposed by von Becquerel. So it becomes von Becquerel's theory. A very important theory for how the basilar membrane is analyzing these frequencies. And that is how basilar membrane is called as frequency analyzer. Basilar membrane becomes frequency analyzer. So hope you are clear with the mechanism of hearing. So I can just show you the mechanism of hearing. Just watch this video. So it will give you a clear imagination of these mechanisms of hearing. So from the point when sound enters into the ear, just watch what is happening. Look at this. Yes, hope you're seeing the video. Yes, listen to the audio also, because you have low frequency and high frequency sounds. Please listen to that. So sounds are entering into the ear, external auditory ear, the tympanic membrane. So the sound is going to vibrate the tympanic membrane. Tympanic membrane is in contact with the ossicles, the ear bones, malleus, incus, and stapes. Yes, did you hear that sound? So the sounds are vibrating this tympanic membrane and the ear ossicles, and how the ear ossicles are in contact with the inner ear. Now look at the ear ossicles. The stapes is in contact with the inner ear. You can see the semicircular canals and the snail-like structure. This is the cochlea. So what you're seeing now, blue color structure of cochlea. Now let's zoom into the structure of cochlea. Scala vestibuli. Below you have scala tympani. And the middle scala media. Scala media is filled with endolymph. We'll zoom into the structure of this organ of corti. On top, the blue portion, scala vestibuli. Below is the blue portion, scala tympani. You have the two membranes. So you can see the sound vibrations are moving into the organ of corti. On the basilar membrane, you can see the organ of corti. Let's zoom into this organ of corti. So we're just zooming into the organ of corti. You can see the hair cells here, the different heights of hair cells. On top, the hair cells are connected to the tectorial membrane. When sounds enter inside, see the hair cells are moving. When the hair cells are pushed like this, stereocilium pushed towards the kinocilium, Action potentials. The sparks that you see, they are all action potentials carried by the 8th cranial nerve. Now, we'll zoom into the structure of the cochlea for an understanding of traveling wave theory. This is the structure of cochlea. It is spiral. You can see a base and you can see a tip on top. The tip is the apex. Now see what happens. Low frequency sounds, they reach the tip. Can you see the green colored marked portion? Low frequency sounds are going to the apex. High frequency sounds, they reach the base. This is called traveling wave theory, place theory, or von Becquerel's theory. So now you're going to hear some sounds. Just clearly listen to the sounds. When you hear a low frequency sound, what is a low frequency sound? Dumb. When you hear one sound like that, that is a low frequency sound. And when you hear a high frequency sound, continuously if you hear sounds, that is a high frequency sound. So when you hear one sound like that, look carefully, it will reach the apex, low frequency. When you hear sounds continuously, high frequency, it will reach the base. Now listen. Did you notice that? Yes, once again. So that is how the place theory or the traveling wave theory works. Low frequency sounds are going to the apex, high frequency they're coming to the base. Quickly, the complete review of mechanism of hearing. When sounds enter the ear, tympanic membrane vibrates. This is the tympanic membrane. Transmits the vibrations into the ear ossicles. From ear ossicles into the inner ear, cochlea. So sound is going into the cochlea now. Place theory or traveling wave theory. Hair cells are moving, action potentials. That is carried to your auditory cortex and thereby you're able to hear. Yes, this is the mechanism of hearing, the simplest understanding of mechanism of hearing. So over to the second question. Heparin prevents mainly conversion of which of the following factors? So the question is on anti-clotting mechanisms. We'll learn about that and then we'll come to this. Answer is option A, prothrombin to thrombin. What are the clotting mechanisms? There are different types of clotting mechanism, extrinsic clotting mechanism and intrinsic clotting mechanism. Eventually, both of them lead into a common mechanism. So first we'll look at the common pathway. What is the common pathway of clotting? Factor 10 is converted into 10A. There are several clotting factors of which factor 10 is converted to 10A. So that step is the common step. What are the factors which help in this common step? Extrinsic, intrinsic, both lead into the common step. What is the extrinsic mechanism? In extrinsic mechanism, TPL, tissue thromboplastin, converts factor 7 into 7A. So there are two important factors involved in extrinsic system, TPL and factor 7. Very important. Two factors involved in extrinsic system, TPL and factor 7. Now, intrinsic system, look at the intrinsic system. In intrinsic system, high molecular weight kininogen and kallikrein, they convert factor 12 into 12A, that converts factor 11 into 11A, and that converts factor 9 into 9A. In this step, extrinsic, intrinsic, both are going to join into the common step. So they have joined into the common step. What are the factors which help in the common step? PL, phospholipids, Ca, calcium, and factor 8. 8 is converted to 8A. So phospholipids, calcium, and factor 8A, they are involved in the common step. Which is the common step? 10 is converted to 10A. And after this, it's all the same. Factor 5 is converted to 5A with the help of phospholipid and calcium. And that converts prothrombin into thrombin. Thrombin converts fibrinogen into fibrin. Fibrin is the clot that is formed. So thereby, a fibrin clot is formed. Who is going to stabilize the clot? Stabilization of the clot, factor 13. Factor 13 is converted to 13A, and factor 13A is called stabilization factor because it stabilizes the clot. This is the clotting mechanism. Why are we learning the clotting mechanism? Only then you can understand the anti-clotting mechanisms. So these are the clotting factors that are involved. What are the clotting factors? Factor 1 to factor 13. Only factor 6 is not there. So other than factor 6, you have all other factors. What are the factors? Factor 1 is called fibrinogen. Factor 2 is called prothrombin. Factor 3, tissue thromboplastin. Factor 4, calcium. Factor 5, labile factor. There's no factor 6. Factor 7, stable factor. Factor 8, antihemophilic factor. Factor 9, Christmas factor or PTC, plasma thromboplastin component. Factor 10, Stewart power factor. Factor 11, PTA, plasma thromboplastin antecedent. And factor 12, Hageman factor. Factor 13, fibrin stabilizing factors. So these are the different clotting factors that are present. What is anti-clotting mechanism? So you have a natural anti-clotting mechanism. What is that? Usually, blood does not clot within the blood vessel. It is not clotting for us. Do you have blood clots inside your blood vessel? No, we do not have. Why blood is not clotting inside your blood vessel? Because a normal healthy blood vessel, the healthy smooth endothelium, it will not provide a smooth surface for platelet adhesion. If your blood vessels are healthy enough, platelets cannot adhere, so a clot cannot form. Secondly, glycocalyx present on healthy endothelial surface repels the platelets and clotting factor. Even if your platelets tend to attract to the blood vessel, the wall, glycocalyx will repel them. So a clot is not formed. Thirdly, naturally itself in blood you have antithrombin 3. Antithrombin 3, it's an inactivator of clotting factors 9, 10, 11, and 12. If you don't have 9, 10, 11, 12, clot cannot be formed. A healthy endothelium, it has prostacyclin in it. Prostacyclins, they can antagonize thromboxane A2 of the platelet. Therefore, platelet aggregation cannot happen. Because of all these factors, inside a healthy, smooth blood vessel, there is no blood clot formed. That's why we don't have blood clots inside. Only if all these mechanisms fail, a clot can be formed. Even if a clot is formed by mistake inside your body itself can lyse the clot. That is called fibrinolytic system. Body lyses the clot, fibrinolytic system. Now, what is the clinical application of anti-clotting mechanism? You have drugs which act as anti-clotting mechanism. What are the drugs? Injectable anticoagulants, heparin. What is the mechanism of action of heparin? It facilitates antithrombin 3. Antithrombin 3 is an anti-clotting factor. Heparin also prevents the conversion of prothrombin into thrombin. Only if prothrombin is converted to thrombin, that can convert fibrinogen into fibrin and a fibrin clot can be formed. But usually this does not happen because heparin can prevent the conversion of prothrombin into thrombin. That's how heparin acts as an anti-clotting agent. I think that is what is the question is asked. Heparin, the mechanism of action is prevents the conversion of prothrombin into thrombin. What are the other anti-clotting drugs that you use? Calcium chelating agents, oxalates. We usually add oxalates in blood banks, blood bags. When you store the blood as a preservative, you can add oxalates. Oxalates, they will chelate calcium. They will take away the calcium. If calcium is not there, clot cannot be formed. So oxalates, by removing the calcium, by chelating the calcium, they are preventing the clot formation. Oral anticoagulants. Heparin is injectable anticoagulant. Oral anticoagulants, dicomarol and warfarin. What is the mechanism of action? They inhibit vitamin K. What is the role of vitamin K? Vitamin K is important for clotting factors 2, 7, 9, 10. Very, very important point. Repeatedly asked point. Vitamin K dependent clotting factors 2, 7, 9, 10. So dicomarol and warfarin, by inhibiting vitamin K, They inhibit these clotting factors. Therefore, clot cannot be formed. This is the mechanism of action of all these anti-clotting drugs. And over to our question. The question was on the mechanism of action of heparin. So heparin prevents the conversion of option A, prothrombin into thrombin. Over to the next question. Yes, third question. Vitamin A toxicity, mainly a biochemistry question, will cause damage to which of these? The answer is lysosome. Vitamin A toxicity causes damage to lysosomes. Hypervitaminosis of vitamin A. What are the symptoms? You can have skin erythema, desquamation of the skin, increased liver size, hepatomegaly. That can cause abdominal pains, nausea, loss of appetite, damages the plasma membrane of the liver. It also damages the hepatic lysosomal membranes. Very important point. Hypervitaminosis, overdosage of vitamin K. Vitamin A. It can act on the liver and it can damage your lysosomal membranes. That is what is the question on. Vitamin A toxicity will cause damage to lysosomes. Option A. On skin also, it has many disturbances, skin erythema, desquamation, and also on the liver. Over to our fourth question. Another question again on vitamin. Magenta tongue is seen in deficiency of. The answer is option B, riboflavin. See, this is magenta tongue. You can see in the image, magenta colored tongue. A purplish red discoloration of the tongue due to riboflavin deficiency or vitamin B2 deficiency. Not only this magenta color of the tongue, it can also cause edematous appearance, flattening of the filiform papillae of the tongue, and it can also cause cracks on the skin at the corners of the mouth like this. You can have cracks at the corners of the mouth, fissures on the lips, inflamed magenta colored tongue. All these are features of riboflavin deficiency, and riboflavin deficiency is known as ariboflavinosis. So the question was on magenta colored tongue that is seen in riboflavin deficiency. What are the causes for riboflavin deficiency? Primary riboflavin deficiency. This is because when you don't take enough vitamins, you can have riboflavin deficiency, inadequate dietary intake. Secondary riboflavin deficiency, always secondary means associated with some other disease, that is called secondary. What are the other diseases that can result in riboflavin deficiency? Chronic diarrhea, malabsorption, like inflammatory bowel disease, gluten intolerance, chronic liver disease, dialysis patients, chronic alcohol intake. All these are secondary causes of riboflavin deficiency. So in all these conditions, you can see magenta colored tongue. Over to the fifth question. Xylitol is what? So xylitol is a natural 5-carbon sugar. What is xylitol? In dental, xylitol has significance. We learn about xylitol. It is a pentatol structure with 5-carbon sugar alcohol. You can see 5 carbon structures here. It's naturally found in fruits and vegetables. What is the formation of xylitol? Hemicellulose, xylan, is transformed to xylose, and xylose is converted into xylitol. And the process is hydrogenation. So from hemicellulose, xylose is formed. From xylose, xylitol is formed. What is the significance of xylitol? Have you seen these sweeteners, artificial sweeteners, sugar-free sweeteners, diabetic patients use that, no? Instead of adding sugar into the tea, sugar contains sucrose. So instead of adding that, they put this sweetener. Most of these sweeteners, they contain this xylitol. It is used as a diabetic sweetener. What are the reasons? Why do you use it as a diabetic sweetener? because it is the only sugar alcohol having sweetness intensity equivalent to that of sucrose. It'll enhance the sweetness. So that's why you add xylitol into the diabetic sweetness. And the other reason is blood glucose and insulin responses to xylitol are very low when compared to sucrose. It has a very low glycemic index. So it is safe if you use in diabetic patients. It has low calorific value. It does not add calories also. That's why it's used as a food additive in bakeries, dairy products, even tablets. When tablets are very bitter to taste, they enhance the taste of the tablets by adding this xylitol. Very important point in dentistry. Xylitol is added to chewing gums and other oral care products. What is the use? So it is proposed that xylitol helps to prevent tooth decay and dry mouth. What is the mechanism of action? It can inhibit the growth of microorganisms present in plaques and saliva after it accumulates intracellularly into the microorganism. It will attack the microorganism. Recommended dose of xylitol for dental caries prevention. You would have seen products like this, chewing gums, dental carie products which contain xylitol. Recommended dose 6 to 10 grams per day, not more than that. What are the health benefits of xylitol? It is low in calories. It has insulin independent metabolism. It has also prebiotic properties. So because of this, xylitol is being used as diabetic sweeteners and also in chewing gums, dental care products. So xylitol is a natural 5-carbon sugar. It's present in fruits and vegetables. The sixth question, all these are true about collagen except. Answer is option A. Phenylalanine is the most abundant amino acid forming it. So this is wrong. Phenylalanine is not the most abundant amino acid in collagen. The most abundant amino acids in collagen are glycine, proline, and hydroxyproline. Of course, it has other amino acids also, a big list of amino acids. Phenylalanine is one among them, but it is not the most abundant. Glycine, proline, and hydroxyproline, they are the most abundant components of collagen. So answer A is wrong. What about the other options? It has a triple helical structure. Yes, collagen has triple helical structure. It's the most abundant fibrous protein. Yes, it is formed by lysyl and prolyl hydroxylation to enhance stability of the structure. Yes. Look at the formation of collagen, how collagen is formed. What are the steps in collagen synthesis? Transcription, translation, prolyl and lysyl residues, they undergo hydroxylation to form hydroxylysyl residue. It undergoes glycosylation to form procollagen. Procollagen forms triple helix structure, and procollagen is secreted into the ECF. And in ECF, conversion of procollagen into collagen. So finally, collagen is formed. So you see that prolyl and lysyl residues, they undergo hydroxylation in the steps of synthesis of collagen. So that is what is there in the option. It is formed by lysyl and prolyl hydroxylation to enhance stability of the structure. Correct. So answer is option A is wrong. All are true except option A. Yes, that completes our discussion on physiology and also biochemistry questions. So any doubts you have, you can post it in the thread. Otherwise, we can wind up the session. So hope it was a useful session. See, please understand something. Physiology and biochemistry are basic subjects, very easy subjects. So if you have a strong hold of these basic subjects, the questions which are asked from basic subjects are usually very easy. You should not get answers from an easy subject. You should not get it wrong. So if you put some effort to learn these basic subjects, definitely all questions in the basic subjects, you will get it right. So let's do that. So I'll be with you, teaching you physiology. Yes, thank you so much for watching. Any questions? Otherwise, we can wind up the session. Yes, thank you all. Thank you for watching. Let's meet in another discussion session. Thank you.